Good afternoon, everybody, and a very warm welcome to Liverpool CCG's annual general meeting for 2020. Obviously, you will have gathered that our meeting this year is somewhat different to how we would have liked to have done it and how we would normally do it. So please bear with us from an IT perspective. Hopefully everything will go smoothly. Obviously, our AGM should be a look back at the year from April 2019 through to April 20, but it's been very much dominated by the final quarter of the year and the COVID pandemic. And without doubt, this has been one of the toughest, if not the toughest year that the NHS has faced in its 70-odd years of existence. And it's been a very sad and a very stressful time for many people, many families, and many of the teams that work across our health and social care systems. But our system in Liverpool has come together really, really well, and our NHS teams have adapted incredibly. Our organisations have worked together, providing mutual aid to each other in a way that we've never seen happen before. So that might be PPE, it might be beds, it might be staff, or just general support. And the way that the CCG has worked with our colleagues in social care has been phenomenal. The example that springs to mind is looking after our shielded patients, and we've come together really well to look after that group of vulnerable people. We're told in a recovery phase or a reset phase, and some days it doesn't often feel like we're making much progress with recovery, and we are aware that it continues to be difficult for patients and that there are delays. And we know that is a worry for a lot of people. Our GPs and our colleagues in the CCG are working really closely with our secondary care colleagues to make sure that we've got safe pathways for patients, that we're communicating really well with each other. And our cancer services are working on a bigger footprint across Cheshire and Merseyside to minimise the impact that COVID is having on diagnosis and tests and treatment. Other things have happened over the last year, and we will touch on them as we go through our presentations this afternoon. And some of them are really positive, and hopefully you'll get a flavour of the good work that the CCG has done in the past year. It's been made me feel very proud to have worked for the CCG for the last 12 months and to have this position as clinical chair. Just from the last little bit from me at the beginning, before I hand over to Jan, is a massive thank you. So thank you to all of you for giving up your time today, and to those of you who sent us in questions. But a big thank you to all of our staff across health and social care over the last year, and particularly the last 6 months, who've gone above and beyond and really done Liverpool proud. I'm going to pass over to Jan, our accountable officer now, who's going to take us through some of the highlights of the year and the annual report. Thanks, Jan.
So yeah, thanks very much everybody for attending our annual general meeting, and this always should feel like a celebration of what we've delivered and improved over the previous 12 months. Sometimes when you're in a situation that we're in now, that feels highly inappropriate, but actually we shouldn't forget the improvement that has been made. And so I want to thank all our providers, all the staff in the CCG and all our member practices for the support that they've offered throughout the year to deliver our operational plan that we were successful in delivering last year, despite it being slightly curtailed towards March, February time. It's worth reminding ourselves the CCG is a membership organisation. Our 85 GP practices form the CCG. We plan and arrange health services for the Liverpool population of over 500,000 people, and we're one of the largest CCGs in the country. We have a budget of over £963 million, and that equates to about £1,900 per head of population that we serve. It actually delivers a significant amount of service. Over 100 and, around 129,000 A&E appointments, both at the Royal Liverpool Hospital and Aintree Hospital, 5,500 appointments at Alderhay, over 700,000 outpatient appointments, well over 2 million GP appointments, and 52,000 extra appointments through extended access in primary care, 74,000 mental health inpatient bed days, 5,300 outpatient appointments for mental health services, and over 135,000 mental health service contacts. In community nursing, that's over 350,000 home visits by community matrons and district nurses. And our walk-in centres and urgent treatment centres deliver over 141,000 appointments, which is even more appointments than actually attend our A&E department. So you can see how valuable these services are to the city in meeting the needs of our population. We invested in over 14 new services last year. And just a few examples, there was a falls pickup service to address the needs of those people who do fall, mental health crisis beds to help support those in mental distress, a perinatal mental health service, a vague symptoms clinic for cancer services, children's palliative care, an escape pain programme, and importantly, an infant feeding pathway. So that just gives you a flavour of the range of services that we've developed and implemented for the residents of Liverpool. We're going to play a short film now, which just flashes out some of these examples in more detail. Thank you.
Good afternoon, everyone. Again, apologies for those little gremlins in the system. So my name is Mark Bakewell. I'm the Chief Finance and Contracting Officer for Liverpool CCG. And I'm pleased to present the accounts for the 2019-20 financial year. In terms of the contents of the accounts, they were prepared in accordance with the National Accounting Manual, and they follow the relevant international reporting standards. The nature of the accounts is they are aimed to describe the key statements of both expenditure and income for the financial year, as well as some supporting statements regarding the CCG's balance sheet and subsequent cash flow statements, with supporting notes to each of those key statements, and obviously some surrounding information regards to the transactions that the CCG undertakes in each financial year. The accounts were subject to external audit. That was taken by Grant Thornton this year, and I'm pleased to report that they were given a unqualified opinion, which in effect means that they represent a true and fair view, and they I suppose set out the fact that we've used our resources in the way that Parliament intended at the start of the year, and that so the sort of third aspect being that the auditors were satisfied that the proper arrangements are in place for securing economy, efficiency and effective use of the resources available. Next slide, please, Ali. Just in terms of the CCG's financial performance, obviously a key aspect of our activities in any given year. Pleased to say that the CCG did deliver all of its required targets for the year, including elements of cash management, payment of invoices, and obviously of most significance being the delivery of a surplus position of around £6.5 million for the financial year, compared to a target of break even at the start of the year in accordance with business rules. Pleased to say that that places the CCG in a really strong position for future years. So not only can we access that surplus in future financial years, but equally we get access to an equivalent amount in the form of part of the NHS England incentive scheme that was offered to the CCG as a result of that surplus position. And again, that's really helpful and supportive in terms of the transformation activities that we know are required, particularly given the impact of the pandemic over the last 6 months. Next slide, please, Ali. Just to give a sort of an indication of outlook, which is obviously again a key part of the AGM focus, it's inevitable given the circumstances that are at the moment around the outlook for 2021 has severely been impacted on by the COVID pandemic, and equally the arrangements that have subsequently had to be put in place given the command and control structure that obviously most of the NHS is currently operating within. That has resulted in quite significant temporary financial changes to the way that CCGs and providers operate. The main aspects of that being revisions to CCG allocations, payment mechanisms to providers within the system, and then retrospective claim processes that all organisations are currently having to go through. It should be of the view that this doesn't give any more risk to the CCG than anyone else, but equally we're still working through the implications of that. And again, a lot of that is featured within the normal governing body reports, which again later today we'll go through some of the more recent updates in terms of what that means. All that said, so it's been a really successful year from a CCG financial performance perspective, and what we'd now like to do is just again play you a short film just detailing a little bit more about how we've used some of those resources to improve the health of the population. Thanks, Ali.
Good afternoon. My name is Jane Lunt and I'm Director of Quality Outcomes and Improvement for the CCG. I'm going to tell you a little bit about the work that we've done around the quality of services. As we've already said, the AGM gives us an opportunity to look back at the year 2019-20 and look at what we achieved during that period of time. As a CCG, our role is to commission services for the population of Liverpool, and we have a specific role to ensure the quality of those commissioned services and secure continuous improvement in quality. We have a quality team within the CCG, which includes the safeguarding team, and they work collaboratively with other teams within the CCG and lots of other partners to undertake those roles. I've picked out some specific highlights. So firstly, in terms of safeguarding, 2019 was an important year for children's safeguarding arrangements. The new multi-agency safeguarding arrangements came into place for children and young people. This reinforced the role of the statutory partners, namely the CCG, Liverpool City Council and Merseyside Police, as the three services with that significant role around safeguarding children and young people. And those arrangements came into being on the 1st of April in light of something called the Wood Review and also the Children and Social Work Act 2017. And we're currently undergoing a review of those arrangements to see how effective they've been in the first 18 months. And what we tried to do as partners was be clear about accountabilities and responsibilities for safeguarding. And we've increased the input from other partners by having regular forum meetings. These were broader meetings with a much more informal flavour to them, where we picked a specific issue to look at. And one issue we did a deep dive into was looking at teenagers and the impact of life as a teenager in Liverpool, and that's led to the development of a specific adolescent service, a multi-agency service between partners in Liverpool. The Merseyside Safeguarding Adult Board continued with a clear focus on hearing the voices of vulnerable adults. There was a specific project commissioned in 2019 which reported in October 2019 to the Safeguarding Adults Board, and the outcomes of that informed the business plan for the board. And we worked with City Safe to develop a domestic abuse strategy for Liverpool. The CCG and wider NHS partners are absolutely integral to this and delivering the action plan. Next slide, please, Ali. So we've had some successes, but we can't be complacent, particularly around healthcare associated infections. We've worked with our partners to reduce the numbers of these infections, whether they're acquired in hospital or in the community, but work needs to continue, and that's particularly pertinent now during COVID. We also worked with prescribers to reduce the numbers of prescriptions for antibiotics, and that was part of a national strategy to help reduce antibiotic resistance, so that when we really need antibiotics, they work and they work effectively. We're proud of our first episode of psychosis services. They performed well, and that's particularly important because for those who do experience psychosis, if that first episode is treated well, there's a huge number of people who return back to work and normal life, and they don't have further episodes. We've continued to have high levels of diagnosis of dementia, and that's important in helping individuals and their families and carers to have access to that vital support. And we've done significant work around pressure ulcers, which can cause much pain for individuals and take a long time to heal. We worked with partners across Cheshire and Merseyside to reduce the incidence in the community, particularly in care homes, but also in hospital settings. And internally, we continue to work to improve the governance for quality assurance and contract monitoring within the CCG. And that might seem quite kind of boring and flat to mention, but it is important because that reflects how we've learned from local reviews, such as the Kirkup review into Liverpool Community Health Services. Next slide, please, Ali. Challenges. around increased access to psychological therapies, because getting access and recovery is hard, but it's so needed in this city because we have high rates of anxiety and depressive disorders. We're working very closely with Merseycare and Alder Hey as the providers of those services to make sure that we make them as accessible as possible and get the throughput that's needed. I've mentioned the accident and emergency 4-hour target and referral to treatment waiting times. We have struggled to meet targets, and COVID has impacted on those in different ways. But as those are, well, the A&E target, particularly as a safety target, it's important that we do strive to continue to meet those targets as a collective. In January 2019, we had a special educational needs and disability inspection, and that resulted in a written statement of action for both of the commissioning partners in the city, the council and ourselves, and we're working with the council to make those required improvements, and we've made a fair attempt at doing that over recent months. And one area that we're particularly proud of is the work that we do with the Parent and Carer Forum, and working with them closely in what we call co-production. And what we mean by that is that parents and carers are actively involved in any service developments and improvements in Liverpool around special educational needs and disability services. Next slide, please. I couldn't not mention COVID given where we are, so just to highlight that since March we have worked across Cheshire and Merseyside with a range of partners to support the response to COVID-19. Some particular examples around specific work was implementing the discharge to assess process, and what that means is partners working together to make sure that we are able to discharge patients from our acute trusts as swiftly and safely as we can, and part of that was to enable the trusts to have beds available to deal with patients coming in with COVID. We've been integral to leading the early responses to the testing of staff and patients, including setting up a range of local testing centres, and that work is ongoing. One specific thing that the CCG did was we delivered infection prevention and control training to care homes and to other settings to support reducing the risk of infection. And one of the real benefits and one of the real positive things that came out of COVID was the mutual aid, the response between trusts and other partners, whether it was our police colleagues, our voluntary and community sector colleagues, or Merseyside Fire and Rescue, who came together to help respond to meet the needs of COVID, whether that was by sharing personal protective equipment, offering training, or staff just helping support the delivery of needed services, and many staff were redeployed. So I'm now going to introduce a short film which will tell you a little bit more about the work that we've done to ensure the quality and safety of services.
we've reached the part of the show where we do some questions and answers. And obviously this is really disappointing for me, because this is the part where really we should be having an interactive discussion and where we really miss that face-to-face contact with you all. But thank you to those of you who have taken the trouble to email us in with some questions. We've got 10 questions to answer in the next short while. My understanding is that the questions in full have not been shared with the entire audience, so I am going to read the question out so that you can make sense of the answer as we go along. So our first question is from Sylvia Dale. Thank you, Sylvia, for raising, I think, a really important question that will be concerning a lot of people. So the question is, I, like many others, am in despair with the unavailability of GPs and hospital appointments. As far as I'm concerned, telephone consultations are a tick box exercise. When will this be rectified? I'm going to answer that question. We recognise that access to services, particularly GP services, is a major concern for people, hospital and GP services. And this was the case even before we had to deal with COVID. Despite media reports to the contrary, GP practices, certainly in Liverpool, have all remained open throughout the entire COVID pandemic, albeit in a very different way to what we're used to. Early on, so in the first half of the pandemic and when we were in lockdown, the vast majority of consultations were done as telephone or video consultations, with only a very small number of patients who absolutely needed face-to-face appointments being brought into the practices. This was very much in line with the guidance that was sent out to GPs and to hospitals for their outpatient appointments, sent down from NHS England. And it was an important and necessary step to manage the risk of the spread of the COVID infection. So if you think about in hospital waiting rooms or GP practice waiting rooms, how crowded and busy they can often get, with often very vulnerable patients being exposed. There was also a real risk about GPs and their staff being super spreaders, so seeing one person after another, and the risk of spreading it. And actually, we had to make sure that we didn't lose entire GP practice teams and then have to shut a practice because the whole team had gone down with the infection. And this was at a point where we were anticipating the situation to be even worse than what we eventually found ourselves in. As we are resetting, the number of face-to-face appointments has gradually been increasing, and we're now up to approximately a third of contacts now are back to face in primary care. So still some way off where we were, but definitely improving in that respect. Throughout, we have GP practices have maintained some of their essential services, such as childhood immunisations, which had to be done in a timely fashion. But now that we're resetting, we're getting all of our immunisations back up, and our smear tests, for example, are getting back to normal. We know that many patients really value that face-to-face contact with their doctor or their nurse. And as clinicians, we really miss them as well. We're working very hard to bring it back in as safe a way as we possibly can. But we also know that very many patients have fed back to us that they really like email consultations or telephone or video consultations. They find it very convenient. I've had some lovely experiences doing video consultations with older patients who I've known for 20 years, and it's been really lovely to actually see them enjoy that interaction. So I think most of myself and my colleagues would say that those remote consultations will be part of our offer going forward, but we know we need to make sure that we're inclusive. We know we need to consider the patients who find IT more difficult to access. So we do really want to understand people's experience of the changes that COVID have brought about and what difficulties you've had accessing services. So we're launching, the CCG are launching a public engagement about this in the next week or so. So look out for that. We will be contacting you about that, and we hope that as many of you as possible will give us some feedback about how you've been affected by the COVID pandemic, so that we can use that information to plan how we deliver services going forward. Okay, and I'm sorry, it just feels really strange to not be able to say to you, does that answer your question? But I hope that it does. I'm going to keep talking now and answer Sylvia's second question, which was how are flu vaccines to be given this year? So obviously there's been a lot in the news about this, and we're still going ahead doing flu vaccines. My own practice, we're starting, we've just had our delivery yesterday and starting on Saturday to do the flu clinics. So we really want to encourage as many people as possible. It's even more important than normal that we get as many people vaccinated for flu as possible. There's a slight increase in the range of people who are eligible for flu. So it's children aged 2 and now up to 11, all pregnant women, everyone over the age of 65, everyone living with long-term conditions, everyone living in residential care homes or long-term care facilities, anyone who is a carer or in receipt of carer's allowance. Obviously, we big push for all of our health and social care workforce to get vaccinated so that we don't spread flu around. And this year, slight change is that anyone who was on the shielded patient list for COVID is now automatically registered eligible for a flu jab, as are their household members. And the appointments will be delivered through your GP practice primarily, but our primary care networks and along with the CCG are having lots of conversations about how we can support and work more as a system for the delivery of flu vaccinations this year. So you might in your area, for example, see flu vaccines being offered to you from a different setting. And we may well, but we hope to be working more closely with our community pharmacy colleagues who can also and have done previously and are an important part of our workforce for delivering flu. You'll also be aware that there's an increased cohort of patients aged 50 to 64. Now, we are still waiting for guidance on that. That extended offer will be put out, but not until November or December, providing there is enough supply of vaccine available. So we obviously have to vaccinate our vulnerable groups first. Reassurance that in all the planning for flu clinics this year, infection control has been a major part of the planning. Every possible precaution has been taken by practices. I know they've been working very hard to maintain that. So you may well find that if your practice previously did open access, just turn up for your flu, that they're not doing that this year. It's all appointments so that they can control the flow of people through their building. So again, I hope that answers your question, Sylvia. I'm going to move on to a question for Jan. Which is about phlebotomy. So if Jan can go live, I will read out the question. Bear with me. I'll find my piece of paper. Okay, so the question is from Margaret Draycott, and it is, can you please advise when the phlebotomy service will be resumed at the York Centre, Sefton Health Park? Margaret does go on to give us quite a lot of detail of her own experience, which is obviously fallen short of what we would all want for ourselves and our patients. But Jan will give you an answer on that one.
Thank you. And a bit like for flu, the way that we deliver services has to change because of infection control reasons, and phlebotomy services has been impacted because of coronavirus on that service, and has challenged some of our facilities in terms of the numbers of people and the numbers and types of clinics that are offered in many of our services. So we've had to operate new guidelines for ensuring care is safe during the pandemic, and both in terms of staffing, but also, as I say, for the types of clinics that are running from particular health centres. So community clinics have had to shift from being drop-in services to pre-booked appointments using online systems. And we know the service is a really crucial one for many patients in the city. And we're working hard with Merseycare and Liverpool University Hospitals to look at how we create more capacity for phlebotomy across the city in more convenient settings. We've even, and you know, even before COVID, who would have thought that we would even be considering drive-through options for some of the services that we're currently providing? I, for one, you know, wouldn't have expected that. But this is about looking about innovative ways of continuing to provide a service with the constraints that we're currently operating under. So at the start of the month, we had around 5,160 appointments available, and we're looking to increase that, significantly increase it. That's about 87% of the pre-COVID levels of activity. But as you know, we're still under demand, and also with COVID, antibody testing requires additional phlebotomy. So if we're going to test people for antibodies, then that also takes up capacity that would have previously been provided by phlebotomy services. So obviously we're looking at alternatives. We're also looking at increasing the number of domiciliary appointments that are available across the city for those who are housebound. But again, it's about how innovative we can be about increasing the capacity and increase the number of staff that are available to be able to offer phlebotomy services. So we're working with our providers to look at different ways of staffing some of the facilities that we've currently got. So I hope you can bear with us. As I say, we will be increasing the capacity across the city for phlebotomy, but it might not always be provided in the setting that you've previously been used to going. And apologies for that, but we'll do what we can.
The next question is from Wendy Rankin, and it reads, I would like to ask why, if so many other CCGs in the Northwest have stopped toenail cutting in the podiatry departments, then why is Liverpool still doing it at a huge cost to the NHS? There's a bit more to the question, but Wendy is essentially concerned rightly about value for money for taxpayers. So thank you for highlighting and recognising the challenge that we face as commissioners all of the time about balancing the desire to provide every possible service to every single patient against the need to provide and ensure value for taxpayers' money. Toenail cutting services, very, very rarely are patients seen purely just to have their toenails cut. Most of those patients have other medical needs or social needs that mean that they need that extra care. And so, for example, diabetic patients, it's really important that we prevent infections and that diabetics have particular attention paid to their foot care. And then frailer and elderly patients, if you ask any care of the elderly consultant, they will tell you stories about how patients who don't have good foot care and don't have their toenails cut are more prone to falls, their mobility reduces and they lose their independence, and then you end up with greater costs to the health service in the long run. My own experience as a clinician who refers into that service is that unless the patient does have these other additional needs, the referral purely to have your toenails cut is generally rejected. Thank you again for raising it. I think we have said in the CCG it's raised our awareness, and we will go back and take a look at the numbers and make sure that that service, that we're commissioning it appropriately and balancing that risk between providing an essential service and giving value for the taxpayer. So thank you very much for that question. Next question is for Jan again. And it is a question, we've got two questions actually coming up from Andre Massey. The first one is, Jan, when do we expect Liverpool's new hospital, the Royal, to be available?
Obviously, this has been quite a saga in its construction and its operation. We are not the direct commissioners of the new hospital. We commission the services, yes, but the new Luft Trust is responsible for making sure that building is handed over and is fit for purpose from its operation. We did use the ground floor for a while during COVID as a step down type arrangement for beds that was managed between the community and the hospital, but in order to make sure that we couldn't open the building in the appropriate time, we had to close those beds after 6 months so that they could get construction workers back on site when they were available to come back on site, to make sure that we can open it in a timely manner. My expectation at the minute is that it will be during sometime between 2021-22, but a definitive date we are not aware of at this stage, but we will keep an eye on, and we will continue to work with Luft on making sure that it's as available to us as soon as it possibly can be.
Thank you, Jan. The second question, Jane, this one is for you, from Andre Massey. I cannot see the hygiene purpose of hospital staff going to work in their uniforms via public transport and returning by the same. One would not know what germs, etc., were entering the building. Does this have to be, and what precautions are being taken?
Thank you, Chair. It does seem a bit counterintuitive. I understand that, and I'm sure that the trusts, if they were asked the same question, would welcome the opportunity to respond. So I'll respond as best I can. So local hospitals and community trusts are taking every precaution possible to reduce the risks of COVID for patients and staff, and they have very strict infection prevention control procedures in place. And so I spoke earlier about the work that we'd been involved in, which was only a very small part of supporting infection prevention and control across Liverpool, but the hospitals particularly have been at the forefront of this and have invested a lot of time and resource in training staff on how to limit the spread of the virus through simple things such as frequent hand washing and other infection control measures, and we mirror a lot of that in the community as citizens, making sure we wash our hands frequently and use sanitizer. So social distancing is important as well, and particularly in hospital trusts, they've had to create more space between patients in wards and in waiting rooms, for example. So they have to obey the 2-metre social distancing as we do. There's been regular deep cleaning of hospital facilities between patient appointments, and also effective use of personal protective equipment for staff, for patients and visitors. And you may have friends, you may have been experienced it yourself. If you've been visiting in hospital or you've been to an appointment, you will have been asked to perform certain things such as washing your hands and sometimes wearing a mask, etc., as part of your visit there. There's also now regular testing of staff and patients for COVID-19, and Fiona, our chair, has already referenced that in one of her answers about being clear about testing, because some people can be asymptomatic and so won't be aware that they are spreading COVID. And treating patients who have symptoms or who have tested positive for COVID-19 in separate units or areas of the hospital. And that was one of the very early things that trusts did. They separated the trusts into red, amber and green areas, with red being COVID, green being non-COVID, and amber where people who were perhaps awaiting a test result and their COVID status was uncertain were cared for until they knew one way or the other. But that's a number of the measures, as well as supporting staff in being clear about how to wash and launder their uniforms as well. It's the simple things like that which can often make a big difference. So I hope that's given a helpful response, but I'm sure the trusts would welcome the opportunity to respond too.
Okay, so Jan, the next question is for you, and we've had questions in from both Greg Dropkin and Celia Kelly regarding potential CCG mergers. They were quite complex questions, quite long questions, so I will we've put them together, and I'll give you the general themes of what we've been asked to respond to. So, if Liverpool CCG intends to merge into a single CCG for Cheshire and Merseyside, or a single CCG to cover North Mersey, how will you demonstrate that you've sought the views of all individuals to whom relevant health services are being or may be provided? If the board meetings now take 2 hours in a public session and we're doing 9 CCGs, what items will have to go from that agenda in order to fit into time available and therefore omitted from public discussion? What will be the impact on the budgets covering services and staffing in Liverpool? The papers for the AGM have said that the policy direction for CCGs in our STP is to typically lead to a single CCG. Prior to this, we've been told that STPs are non-statutory and informal. What legal power has NHS England got to enforce this plan? If our memberships were to refuse to join an STP-wide ICS, what financial penalties would NHS England be able to impose, if any? And all major reorganisations of the NHS require public consultation. So has this taken place, and if not, when will this be? Now, that is a really comprehensive, long list of questions. We are going to provide some written answers to everybody who sent us in a question as well. So you don't need to take notes, but over to you, Jan.
Okay, thank you. I'll try and cover them in some kind of order, if I can, in some way. So first, I'll consider the merger of North Mersey CCGs, and you'll be aware that we've been discussing this for some time, and for us, we think there's levels of commissioning that can be done at different levels, and we want to recognise the population that we serve, and we've got very similar needs across the North Mersey CCG populations. Many of our providers serve that population, and we would reduce significant amounts of confusion and bureaucracy, and that was the whole basis on which we'd addressed and put forward a suggestion that we should merge. The guidance, the legal requirement for mergers is that we engage with our stakeholders and our population to seek their views. There isn't a requirement for formal consultation in a merger of an organisation in this way. There is in dissolution, but we weren't proposing that. We're not in legal directions, so that wasn't a requirement. But we were required to submit an application to merge to NHS England, and recent guidance has been updated, which is available on NHS England's website, for CCGs that are proposing mergers from now going forward. We sought, our chairs of the 4 CCGs sought guidance really from NHS England, from Bill McCarthy on, at the start of COVID, he'd proposed that any applications to merge were paused. So the chairs wrote to NHS England just to ask the question, will you be refreshing that guidance and will you receive the application? And to that, we've received a letter back, which we've reported on in the governing body meeting, to suggest NHS England's view is that they wouldn't be considering a North Mersey merger. They would prefer, as in NHS England's guidance, a CCG on the footprint of the integrated care system, which is Cheshire and Mersey. This is recent information for us. We don't have any more detail at this stage. It begs a whole range of questions for us as a CCG and as North Mersey, and we'll be pursuing those questions with NHS England and the Cheshire and Mersey Partnership over the coming weeks. In terms of the legal basis, NHS England approve any application to merge CCGs, and that is based on NHS England North West making a recommendation to a committee from NHS England, and they would determine whether or not they supported that application, but there is no appeal process. So we are at the point of having to consider our next steps in respect of the North Mersey application. In terms of how a CCG would run across Cheshire and Mersey, obviously I can give a personal view. If I was an accountable officer for a Cheshire and Mersey CCG, how I would run things, but obviously that would be dependent on a whole range of things, such as the Constitution, and what their governance arrangements were going to look like, what would be devolved to place-based level, and what those arrangements would be managerially. But they would be under the same constraints and requirements of engagement as any other CCG. So I think it's a case of we'll have to see how this develops over the coming months, and obviously we will keep governing body members and members of the public who regularly attend and ask us lots of detailed questions. Obviously we will want to respond to those as honestly and transparently as we possibly can.
Thanks, Jan. I think it's fair to say it's an evolving situation, and we have even more questions than you've provided for us this afternoon, and we will keep you informed when we know more. Our next question is from Jack Coots, and it's about dementia. Liverpool's Joint Health and Social Care Dementia Forward Plan 2019 to 24 reported that local dementia diagnosis rates had fallen from a commendable 78% in 2015 to 69.7% in November 2018. The most recent figure is now 60%, which cannot be entirely attributed to COVID-19. The Forward Plan acknowledges the crucial importance of prompt diagnosis. And could you please outline some of the action that is being taken to address this priority? So definitely dementia is a priority for all of us. The question there is talking about diagnosis rates, which could be taken as new diagnoses. We also look very closely and monitor our prevalence rates, so the total number of patients that we have on our practice dementia registers. And very sadly, COVID has impacted our prevalence figures. This group of very vulnerable patients has been disproportionately affected by COVID, and our hearts go out to all of those families and the carers who have had to go through this quite dreadful experience. In terms of new diagnoses, yes, patients are not presenting at the GPs. I've talked already about how difficult it's been to do face-to-face consultations, and I think there are a combination of reasons why we've not had as much contact with this group of patients. I think families have done a wonderful job at protecting their older loved ones, and have kept them at home in their bubbles and socially isolated them. I think as well that that's meant to a certain extent that old people have had more family around them sometimes. Very often the trigger to them presenting at the GP practice is not, I think I might have dementia, but more that not coping with things that they previously coped with, and that's not as apparent when there's people around them, or sadly when people are not seeing them and they're not having as much interaction. There's also that missed opportunity when we're not doing those face-to-face appointments that we miss so much, where you just think, oh, you're not doing as well as you used to, and picking it up opportunistically. It's very difficult to do pre-referral diagnostic workups, so doing blood tests or arranging scans in the current arrangements with COVID. So that has had an impact as well. And our specialist services to refer into were virtually stopped during the height of the pandemic. So there is a fair amount that can be laid at the door of COVID, but we need to be mindful that our numbers were falling even before COVID, and that this is something that we need to do better at. What actions then are we taking? The CCG team, dementia team, have been working closely with Merseycare teams since we've been looking to do the recovery from COVID, and we are actively now looking for those missing patients. GP practices have been asked to start thinking about their patients and risk stratifying them, and really focusing our attention onto the most vulnerable members, so patients who've been shielding, patients who might be socially isolated, our older, frailer patients. We are increasing the use of care navigators and social link workers, social prescribers, and I think that will help us improve our pickup rates. I think that COVID and our increased use of technology, it does highlight the IT issues. Now, I am definitely not saying that all older people struggle with IT. They do not. I've had some fantastic consultations with older patients using their mobile phones or videos or whatever. But patients who perhaps are developing a bit of cognitive impairment may struggle more, and we need to be really mindful of that and take that into consideration. On a positive note, prevention is a really major part of our Healthy Liverpool plan, and smoking prevalence is going down, and that's a major positive thing for the rates of vascular dementia diagnoses. So we're looking at this from a variety of different angles, and we do want to keep working with the Dementia Alliance. We know what an important job you guys do, and we have to do that work with you to improve this situation. So thank you for that question. Nearly there. We've got question 9, was almost more of a comment from Mark Gabby, who was keen that we had a mention for the Applied Research Collaboration Northwest Coasts work. So that's the ARC, and that we mentioned it at the AGM. And I know, Jan, you have been very involved with the work of the ARC, and you've probably got a few things you'd like to say about it.
Yeah, certainly. And, thank you to Mark and his team that I worked with very closely to put a bid together to nationally to secure the ARC for the continued future. It covers the Northwest Coast. It's a partnership of health and social care, NHS commissioners, local authorities, universities, public advisors and the Innovation Agency working together to support health research aimed at reducing health inequalities across our area. Liverpool CCG hosts the ARC for the Northwest Coast, and we're proud to do so. And that's partly because we do get the added benefit of doing much of the research around health inequalities actually with our population. And it's thanks to Mark and his team that we are enabled to do that. We've got access to a range of projects and experienced researchers that do work, and there is work going on even reviewing progress in patients' experience of COVID, led by Lancaster University. We're publishing a household health survey exploring health inequalities in disadvantaged communities across the Northwest. We learn and we benefit as commissioners from what the ARC can deliver in terms of that research, so it's vitally important. It wasn't an omission in the annual report because that was based on the services we commissioned, but I'm really grateful to Mark for putting that question in because it gives me an opportunity to talk about it, so thanks for that.
Thanks, Jan. Thanks, Mark. Final question has come in from Jens Welsh. I would like to ask the CCG whether it is possible to consider holding their future AGMs online, as well as inviting people to attend in person. This would increase audience capacity and access, particularly for the many disabled people who can't attend in person. This is a great point and a great question, and something that we had actually been talking about previously. So as much as we would much prefer to have that interactive experience with you, as I said, I think the future will be a combination of both, because what we have realised doing more and more of our meetings online is that it is a very effective and efficient way of communicating with each other, and it does increase access, as you've pointed out, Jen, so thank you. We've had to look at lots of different ways about how we communicate with the public throughout COVID, and hopefully it will allow us to increase the number of routes that we use. We are always keen to hear from people about their thoughts on how we communicate, as well as the services that we commission and how we're doing generally. If anybody else has got any comments, you can feed them back to our communications team. And I think, Ali, have you got a closing slide with the email address on it? Because I'm going to wrap up now. So the full annual report and accounts will be on the website for you to access. Apologies again for the technical difficulties that we've had today. As my mum would say, every day's a school day, and we will go away and practice some more to get it right. Keep in touch with our communications team, as I've said. Thank you from me and from all of us, really, to all of our CCG staff, to our members and to our stakeholders for all your hard work and your commitment above and beyond over the last 6 to 12 months. Thank you to the CCG team who have put together today's event, and hopefully next year we will be back with our marketplace and our more interactive, but a live stream at the same time, and it'll be a much more interactive experience. Even for those who are accessing it remotely, I'm sure we can find some way to make it more interactive. So that is the end of our AGM. I cannot, as a clinician in the city, not take the opportunity to remind everybody to wash your hands and remember to social distance. And please keep safe and take care, everybody. Thank you very much for joining us today. Bye-bye.